COVID-19. What is it? What do we know about it? Why should I care? Hi, I'm Dr. Jen, the OBGYN. And even if you aren't pregnant, there are some basic things to know about COVID-19 that will help you make decisions in the next couple of months, including whether any of this applies to you and your family. Let's get started. What is COVID-19? Well, COVID-19, the coronavirus disease of 2019, is the name for the symptoms caused by SARS-CoV-2 virus. SARS-CoV-2 is a novel virus, meaning we've never seen it before on the face of the planet. And it's a coronavirus, which means it is part of a family of viruses that include the common cold virus and some animal viruses. This is not to be confused with Corona, the drink, which is totally safe to drink. Now, because most of us have had the common cold, a lot of people think, well, don't I have antibodies to this coronavirus? And the answer is absolutely not. None of us have immunity to this completely brand new virus. Again, it's called now the COVID-19 virus because SARS-CoV-2 is just way too confusing. So that's what you'll see in the media. Is COVID-19 like the flu? And the answer is actually a lot of the symptoms are very similar. Fever and dry cough are the most common. Runny nose is not so much. And it's about an average of 2 weeks in recovery in the mild or moderate cases, which are about 80% of the cases. It is thought to be transmitted the same as influenza, close-to-close human contact, droplets in the air with coughing and sneezing, droplets that land on surfaces that people touch and then touch their face, and coming to a continent near you. Unfortunately, in the last 24 hours in China, we have found that there's 2 strains of this COVID-19, and one of the strains is actually a fecal contact strain, meaning that areas of poor sanitation or just fecal contamination, unless you wash your hands with soap and water, you're going to get infected. What makes COVID-19 more dangerous than the flu? Well, there are no treatments at all for COVID-19. Influenza, we do have antiviral medications, but they've tried those medications in COVID-19, no joy. They've even tried HIV medications, and we have not seen much success yet. There are no vaccines yet for COVID-19, and these are going to take about a year or 2 to develop. Unfortunately, the death rate from COVID-19 is also significantly higher than seasonal flu. We're talking 3.4%, and that's within the last 24 hours that the WHO gave us those numbers. That's versus 0.1% for seasonal influenza. COVID-19 also spreads more quickly. When one person gets COVID-19 virus, they actually can infect 2 to 3 more people on average. With seasonal flu, they're really only infecting another just over 1 person on average. COVID-19 spread is also very similar to that of the 1918 flu pandemic. And in that flu pandemic, 1 person infected another 2 to 3 people, just like with COVID-19, and the death rate was about 2.5%. So you'll see the Netflix pandemic series actually talks about that in a pretty good series, worth checking out. Why don't we all just wear masks then? Well, they've actually done a study on the average amount of times a human being touches their face in an hour. It's over 20. Touching our face is a huge method of transmission. So the only effective masks here being N95 respirators. These things are really uncomfortable. They're hard to breathe through when they're fitted properly. Guess what? Lots of touching to adjust them. So this is why experts are not recommending that we walk around in masks that would force us to touch our faces. Who's most at risk for COVID-19? Well, those with underlying health problems are at the highest risk of death. We're talking up to 15% mortality for severe underlying health problems. Cancer, hypertension, chronic respiratory disease, diabetes, cardiovascular disease, we're talking about 5 to 10% death rates just from those alone. And it looks like in China, The mortality rate for men is twice that of women, but the smoking rate for men is significantly more than women in China, with some estimates that almost 50% of women, or I'm sorry, 50% of men smoke in China, and less than 2% of women smoke, which I did not know. So smokers, unfortunately, beware, including your vapors. Now, if there can be one small ray of sunshine in all of this, it's that children under the age of 10, very few deaths, if any, unless those children have significant underlying health problems. And even under the age of 49, it looks like the death rate is under 1%. But when you start getting over 60, that's over 3%. And over the age of 80, over 20%. So for a lot of us that have elderly members of our family, what I'm about to talk about is very important for spread, especially since if we have small children in our families, yes, we love them, but they are walking petri dishes. And we do know that they have the virus in their systems, some of them. We're just not completely understanding if they don't get infected quite as much as the adults do, or if they get infected and they're more carriers. Whatever it is, unfortunately, our children may be on the safer side themselves, but on the not so safe side for potentially passing it on to us when they're in environments like schools. And this is the reason why school administrators are having such a difficult time trying to decide what to do. Why is an incubation period a really big deal with COVID-19, especially for making decisions as to whether or not to attend events? Well, an incubation period is the amount of time between exposure to an infection or the virus and the appearance of first symptoms. If you look at the bottom of that slide, seasonal flu, just 2 days. So we tend to get symptoms right away when we come into contact with the seasonal flu virus. Even our more severe seasonal flu viruses, like the swine flu, it's only like 1 to 4 days. But when you start getting up in coronaviruses like SARS, MERS, and COVID-19, well, SARS and MERS were about a week or less, and that was part of the reason why we were able to control them much more easily than we've been able to control the COVID-19 virus, we have people walking around for at least 2 weeks before they ever show any signs of having the virus. You can understand why this is so difficult to control. So a small story, within the last couple of weeks, the WHO organized a mission with the Chinese government that allowed 13 foreigners to join 12 Chinese scientists on a tour of 5 cities in China to study the state of the COVID-19 epidemic and the effectiveness of the country's response. The findings shocked the scientists. They felt when they went around to see the hospitals that they were going to be seeing just huge numbers of people in the hospitals and the clinics. Just plain old, they weren't there. A lot of these places were just emptying out or completely empty. And they weren't sure they could believe what they saw until they saw it over and over and over again. And the scientists, at least for what's published, came to the conclusion that there's an actual real decline in China where new outbreaks of this virus are concerned. They're just not sure, once the population goes back to doing their regular activities, that that's going to stick around. So here's a list of all the things that China did. See how many of these might apply in our lives. The first thing they did was build 2 dedicated hospitals to only COVID-19. With that, they sent 1,800 teams of 5 people or more to trace tens of thousands of contacts and isolate those contacts. The second thing was they closed down sporting events, theaters, businesses, sent kids home from school. It's called social distancing. And then they took 53 million people and put them under mandatory quarantine. And they've still been there since January 23rd. These restrictions are enforced by apps like Alipay and WeChat, and they even have color codes on phones to say whether or not people are allowed or disallowed to travel. That's enforced by the military. That's 500 million people that they've stopped from, or that they're monitoring for travel. Other regions in China, people are either voluntarily quarantining or they're monitored by appointed leaders in their neighborhoods. Okay. what do we know works to prevent transmission in the United States? Well, we do know quarantining works. We also know social distancing can work. As a matter of fact, Italy in the last 48 hours is now closing all schools and universities for 2 weeks. Granted, they have over 2,500 confirmed cases and 79 deaths, and we are in only a little over 200 cases and 12 deaths as of the time of this video. But this is something that we know is being discussed extensively in the United States, especially with major conventions going on. A lot of people are really trying to make decisions as to whether or not this might be a good idea and they should join them. We know that enforcing those with symptoms of any illness to remain at home works, especially since having other illnesses is a comorbidity that can put people at really high risk who develop this virus. We do know that hand washing with soap and water works to prevent viral transmission. Now, I do have on here that the greater than 60% alcohol-based hand sanitizer only if no soap is available, but that will not help the COVID-19 strain that is passed along with fecal transmission. So please carry soap with you, even carry a water bottle with you. This is going to be your safest method of cleaning your hands. And we do know from studies that using disposable paper towels is actually the first choice to dry hands, as opposed to air drying or using reusable cloth. This is part 1 of a 2-video series. Please text COVID-19 to 44222 if you'd like alerts to new information about COVID-19, particularly with pregnancy. And in the second video in this series, I'm going to be talking a little more about pregnancy and COVID-19. Thank you for joining.